Happy end of September, everybody. Happy end of September. I'm your host, Dr. Peter Glidden, here with you for another live edition, September 30th, 2013. September 30th, 2013. We are back in the saddle again. Yeah, I know. That's why I don't get paid to sing. Just came from a 3-day longevity lecture tour. Was in New York City, Manhattan. That's right, baby. The city that never sleeps. We were in Taunton, Massachusetts, which was known as the silver capital of the colonial era, and then we were up in Manchester, that's right, Manchester, New Hampshire, spreading our message of health recovery through science-based, clinically verified medical nutrition to anyone who would like to listen. We hit it out of the park, if I do say so myself, on all three venues. On all three venues, we had lots and lots and lots of people who were sick and suffering and hungry for our message of science-based, clinically verified alternatives to drugs and surgery. Science-based, clinically verified alternatives to drugs and surgery, because everybody is sick and everybody is suffering in this crazy world that we call the 21st century. And guess what? Obamacare is set to click in tomorrow, October 1st. Obamacare is set to click in tomorrow, October 1st. And what does Obamacare do? Obamacare gives us access to the system of medicine, which is the leading cause of death in the United States and the leading cause of bankruptcy in the United States, and the system of medicine which, while we have been under their care and under their tutelage, Alzheimer's has risen from obscurity to become the 6th leading cause of death in the United States. Autism has skyrocketed from 1 out of 10,000 to 1 out of 50. Heart disease isn't getting any better, even after we spent $20 to $23 billion a year on cholesterol-lowering statin drugs. Arthritis rates are climbing, infertility is climbing, high blood pressure is climbing, and that time the pun was intended. Our health is getting worse and worse and worse and worse and worse, and now Obamacare is going to give us mandatory access, make it mandatory for us to buy insurance, to give us access to the system of medicine, which is the leading cause of death in the United States. Isn't that just Jim Dandy? This is because everybody is under the false belief that MD-directed medical care is the alpha and the omega of medicine, and that the MD knows what's best for them. The MD knows what's best for us. The MD is the only go-to person for health care in the United States. Well, in the free world, quite frankly, the MD doesn't know everything about medicine. Your MD only knows what they've been trained in. And what they've been trained in is just one small piece of the pie of medical science. They've just been trained in one small piece of the pie of medical science. They don't have a secret decoder ring to all things medical. Your medical doctor only knows what they've been trained in, and they don't know anything about medical nutrition. And furthermore, the perspective that they bring to bear on the delivery of medicine, on the pathogenesis of disease and how to treat things, the perspective that they look at the world through is jaded, old-fashioned, outdated, and quite frankly, dangerous. It's called Newtonian reductionism. An MD is trained to look at the human body as if it is a machine. This is why when you go to an MD, you're given all of this diagnostic nonsense, right? You have 17 x-rays when you really only need one. You give it an ultrasound and an MRI and a CT scan, not because you need them, but in order to jack up the bill, because in the United States, medicine is a for-profit runaway train. It's different in Canada. It's socialized medicine in Canada, so they have a better lock on excess. So in Canada, guess what? You get 2 x-rays instead of 20 that you'd get in the United States. Why do they give you 20 in the U.S.? Because they're trying to pad the bill. If your insurance will pay for it, they're going to order the test. Oh, just to be safe is the rationale. But I digress. So we get access to the system of medicine that consistently fails us because it's based on Newtonian reductionism. So your doctor believes, your MD is trained to believe that your body is a machine made of parts, and it's the doctor's job to take the body apart, to find a piece that's broken, and then to deliver a synthetic drug, the intention of which is not to cure the condition, but to manage the condition. So you visit the MD, you get one medicine for your blood sugar, One medicine for your blood pressure, one medicine for your eczema, one medicine for your asthma, one medicine for your colitis, one medicine for your thyroid condition, one medicine for your anxiety and panic attacks, one medicine for your insomnia, one medicine for the high blood pressure, one medicine for whatever. For goodness sake, you need a medicine to pee and a medicine not to pee, a medicine to fall asleep, a medicine to wake up, a medicine to poop, a medicine not to poop. For goodness sakes. This is the worldview of the MD, that your body is a machine. It's a coincidental amalgamation of biochemicals that started in an antediluvian swamp millions of years ago, and that the human body is this evolutionary accident. There's no soul, there's no intelligence, there's no vital force. Your body is just a chemical soup, a biochemical soup that the MD has free rein to adjust and modify with their treatment strategies. Your medical doctor is trained not to cure anything, but to attempt and to orchestrate a hostile takeover of the biochemistry of the human body, a hostile takeover of the biochemistry of the human body. So rather than discover what's the cause of heartburn, which is not enough stomach acid, heartburn is caused by a deficiency in stomach acid. The medical doctor develops a strategy which is to eliminate all of the stomach acid in your stomach completely, to give you a treatment which completely eliminates and eradicates all of the acid in your stomach completely. Well, guess what? If you do that, that will make the heartburn go away because there ain't no more acid in there. But if you don't have any more acid in there, your stomach can't digest food, and if your stomach can't digest food, your body is going to be nutritionally deficient because that's where it gets its nutrients from. So the longer that you're on antacids and proton pump inhibitors and things that completely obliterate your body's ability to have healthy stomach acid, the sicker and the sicker and the sicker you get, and the more chronic diseases you get. So you become overweight, you get high blood pressure, you get type 2 diabetes, you get arthritis. You start to get insomnia and panic attacks and restless legs at night in bed. Why? Because your MD is an idiot. And I'm choosing my words carefully. Your MD is an old-fashioned, has aligned themselves with an old-fashioned, outdated, archaic, dangerous, and completely incorrect medical philosophy. They do not believe that your body has the ability to fix itself. They do not believe in the soul because nobody's ever measured the soul. Your medical doctor may be a God-fearing person. They may go to church every morning at 8 a.m. They may recite the Torah. They may do whatever they do. They may meditate for 2 hours in the morning and 2 hours in the evening. They may be a deeply religious person, but when they're at work, they're atheists. Because MD-directed, reductionistic, allopathic, pharmaceutical centrist medicine is atheistic. It is. It does not believe in the existence of the soul, nor anything that comes along for the ride. And so the medical doctor's job is not to cure anything, but to manage your symptoms with drugs and surgery and drugs and surgery and drugs and surgery and death. And all of the research money that they get goes towards forwarding this particularly archaic, outdated, dangerous philosophy. You know, it's like asking a medical doctor how to cure your illness is like asking a communist about voters' rights. Communist doesn't know anything about voters' rights because they don't think that people should have the right to vote. That's not even in their consciousness. Right to vote? What are you, crazy? The population doesn't know what's best for themselves. The state knows what's best for themselves, so therefore the state's going to take over. The human body doesn't know what's best for itself. The medical doctor knows what's best for itself. Therefore, when you're sick, you're screwed, and your best option is to let the doctor march in with symptom-suppressive drugs to override the inherent wisdom and biochemistry of the body. Your medical doctor doesn't even know how to cure heartburn. They can't cure heartburn, for goodness sake. They can manage it with the little purple pill. And to the profession that can't cure heartburn, what, are we crazy? We've given nearly $1 trillion, $700 billion now, $700 billion to come up with a cure for cancer. They can't even cure heartburn, but they're going to discover a cure for cancer. Well, gee, I wonder why our health is going to hell in a handbasket. I wonder why cancer isn't even close to being cured. Richard Nixon started the war on cancer in the 70s. Well, guess what? We're still fighting it. It might have been the 60s. But the point is, we've taken the wrong dog to the hunt, and we don't need Obamacare to give us more access to a failed system of medicine. The system doesn't need to be upregulated. The medical system in the U.S. doesn't need to be downregulated. It doesn't need to be massaged. It doesn't need to be streamlined. It doesn't need to be tweaked. It needs to be abandoned because it does not work. It does not work. It doesn't work. And Dr. Wallach and myself are the only ones that are saying this. Everybody else is mollycoddling the Machiavellian MDs. Everybody else is mollycoddling the Machiavellian MDs. If you don't know what that means, look it up. Everybody else is mollycoddling the Machiavellian MDs. And it's nonsense. Their therapeutics don't work. That's why I named this radio station, this radio show, Fire Your MD Now. That's why I have named this radio show Fire Your MD Now, because that is exactly what I want you to do. It's not hyperbole. I'm not speaking, in shock jock language. It's exactly what I want you to do. Because when it comes to chronic disease, they have nothing for you but drugs and surgery, drugs and surgery, drugs and surgery, death. Oh, yeah, and then before that, a gigantic medical bill. Ineffective treatment piled upon ineffective treatment piled upon ineffective treatment makes for, guess what, ineffective treatment. It's time we all collectively stood together and lifted ourselves out of this unbelievably ineffective morass. Ladies and gentlemen, fire your MD now. Clean up your diet, eliminate the 10 bad foods, take the appropriate Healthy Start Pack as per your body weight every month. Increase your consumption of antioxidants. Get at least 20,000 antioxidant points, ORAC points a day into your body. Join longevity, live long, and prosper. Going to Germany when we come back. I'm Dr. Peter Glidden, back in the saddle. Today is September 30th, 2013. Don't even think about touching that dial. You're welcome back, everybody. Dr. Peter Glidden here, September 30th, 2013. If you're trying to watch the live video feed, again, Google Hangout has failed us. They failed us miserably. I think we're going to have to try another venue because the video feed with Google Hangouts keeps failing. I don't know what's up with that. But that's not why you're listening, and that's not why you're calling. Gottfried from Germany is a problem with type 2 diabetes, I believe. Hey, Gottfried, welcome back. You are live.
Hey, Doc. Thank you.
What's the latest, Gottfried? Give me some good news.
Yeah, the lady will start work from tomorrow, so I'm waiting for her. That is one of the good news.
Oh, good.
And the second one is that have you got any feedback from my laser stuff?
Yeah, I found one of my colleagues who has had experience with this. And as far as he was concerned, the damage that's been done, it is entirely itinerant upon how much scar tissue is there. It's entirely itinerant upon how much scar tissue is present. Now, I've had patients that have had fake knees, right? They've had knee replacement surgery, and there's a lot of scar tissue, and that's involved. And, of course, they were told that by their MD that the reason that they needed the knee replacement in the first place was because there was no connective tissue, there was no cartilage left, it was bone-on-bone arthritis, and that they were basically out of luck. So they went ahead and they had the knee replacement program, and then a couple months later, they had trouble with the knee replacement, and so instead of doing another stupid thing, they came to see me and put them on Dr. Wallach's nutritional support program, and they grew cartilage over the fake knee. They grew cartilage over the fake knee. Now, that was supposed to be impossible to do. So the body's ability to fix itself is remarkable in this degree. And, we don't know how far back the body can bounce. Sometimes there's too much scar tissue. Sometimes there's been too much damage. Sometimes the body can't bounce back, but sometimes it can. And we don't know where that dividing line is. So the add-on here, in order to support and promote proper eye health, given the stress to your body of that particular surgical procedure, would be the Fucoid Z. The Fucoid Z. The little capsules.
Fucoid Z.
Yeah, F-U-C like Charlie, O-I-D like David, and then Z like zebra. That's F like Frank, U, C like Charlie, O-I-D like David, and then Z like zebra. That's an extract of a sea vegetable that contains a biochemical ingredient called fucoidin, F-U-C like Charlie, O-I-D like David, A-N, fucoidin. And fucoidin has been documented to stimulate the generation of new cells in different parts of the body. It also kills cancer cells. It's anti-inflammatory. There have been over 1,000 published studies on the positive effects of fucoidin. So if I was attempting in my body to get rid of scar tissue and to help my body generate new tissue in its place, if that was even possible, then I would do Fucoid Z. Now, there's two ways you can get that. Yeah, you can get it in little capsules, or you can get it as part of a liquid super juice called Z Radical.
Okay.
But given the fact that you're in the UK, the encapsulated form of this would be more economical, because it's much easier to ship and it's much less expensive to ship because it weighs, 1,000 times less than the liquid does. So now, the next most important question is, well, what dose do we take? And nobody knows. I would take at least 2 bottles of the Fucoid Z a month, at least 2 bottles of the Fucoid Z a month. I believe there's 60 capsules in 1 bottle, so that would be 4 caps a day, 2 capsules twice a day of the Fucoid Z, in addition to everything else that you're doing. And remember, the trick for you with the blood sugar, right, is to maintain the dosage of your drugs and add the nutritional supplements in the diet. And then when you see your blood sugar starting to come down, that's when you reduce the drugs. And then they come down a little more, and you reduce the drugs a little more, and they come down a little more, you reduce the drugs a little more, and that's how we're going to do it moving forward. It's a much better program than to just go cold turkey without any of the drugs at all, because, that can be, a little too much stress on the human body. That makes sense, right?
Yep. The second question is with a downline who discarded fire the MD, fire everything about the MD. Hello?
You gotta love it, Godfried. All right, Freddie, stick around. I'll pick that up on the other side of the break, because it's a hard break and there's nothing I can do about that. Stick around, folks. We're talking to Godfried, and then we're going to go to Joyce in New York. I'm Dr. Peter Glidden, and this is Fire Your MD Now. Welcome back, everybody. Dr. Peter Glidden. We're talking to Godfried in Germany, who has a question about someone in the downline. What's up, Godfried?
So this downline of mine is 65-year-old, a diabetic of 20-something years standing with needles. And then after the first month on the product, he fired his MD, threw out all the insulin, and is totally dependent on the protocol. But, being on the protocol for 3 months, he's not seeing any sign. But he said he will not go back to the doctors and he will not take the insulin anymore, because he heard you talking that the body has the ability to fix itself. So he trusts on the product.
Okay, so is he type 1 diabetic or type 2 diabetic?
Type 2.
Type 2 diabetic, okay. So, well, the body can fix itself, and type 2 diabetes, from our point of view, is a chromium and a vanadium deficiency, as well as a number of other minerals and essential fatty acids. But here's the deal. I don't know what would be a good metaphor here. He's been type 2 diabetic, taking insulin for how many years now?
25.
25 years. So the old-time naturopaths used to say that it takes 1 month for every year that the body's been in trouble to get back on its feet once you're on board with the proper treatment. So it could take 2 years for this guy's body to be able to adjust back to its normal healthy state of being able to metabolize blood sugar without the help of extracurricular insulin. It might take that long. It's kind of like if you had a broken bone, you need to put a cast on the leg and walk around in crutches. And if you took the cast off too soon, or threw the crutches away too soon, then it wouldn't work. So, blood sugars being extremely high are dangerous. If your blood sugar is too high for too long, things can really start to go wrong in the body, and that's dangerous. I mean, I'd really have to talk to this guy individually to see just how high his blood sugars are without any insulin whatsoever.
Blood sugar level is 200.
200, was that fasting in the morning?
Yeah.
Fasting blood sugar level, then I'm okay with that. So, how many sweeties is he taking every day?
12.
12, and how much does he weigh?
He 150.
Okay. So have him take 9 EFA plus a day as well. 9 EFA plus a day.
Okay.
And make sure he's not taking, I don't want him to even look at a carbohydrate until the end of the year. So, right, I don't even care if it's gluten-free. So no grains, no fruit juice, no dried fruit, no nothing that's sweet, no honey, no maple syrup, no agave. The only thing sweet that he can have is a vegetable, right? So he can have vegetables, cooked or uncooked, and he can have protein, and he can have fat, but I don't want him to have any carbohydrates because we really need to up the ante here. And, I'm assuming, right, that because he's with you, he's gluten-free. Is that correct?
Exactly.
Okay, great. So he just needs more time. 12 sweeties a day is a very good place to start. And he can also give his body an extra break by completely eliminating, anything that his body turns into sugar until his body gets on the other side of this. And what happens here, Gottfried, is that it's kind of like watching a snowball roll down a hill, right? It's a little bit and 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 a little bit, and then all of a sudden it takes off. So I don't know at what point in time his blood sugar is going to start to normalize, but it must start to normalize because it's simply a function of not having enough minerals in his body. And so he has to just give his body a lift, give his body a lift, give his body a lift, give his body a lift. Keep doing it. Give his body a lift. And then with time, the blood sugars will normalize. A better thing for him to do would have been, to stay on the insulin, take our stuff and our diet, and over time, his blood sugars will start to get lower and lower, and as they do, then he can wean off of the insulin. That would have been a smarter way to do it. But since he's already gone cold turkey, then, we might as well roll these dice for another 4 weeks. That's not a bad idea. But if the blood sugars start to go up over 200 in the morning, or if they start to go up over what his baseline is now, in the next couple of weeks, I would just counsel him to go back on the insulin and understand that this is a process, right? It's not an event. It's something that needs to unfold over time, and we need to give the body a break. And sometimes going cold turkey is not a bad idea. Sometimes going cold turkey is not a bad idea. So either way, he needs a little bit more time as we move down the road. Does that make sense?
Yes, sir.
All right, Gottfried, you're the greatest. Keep up the good work there in Germany.
I'll give you feedback, okay?
I'll look forward to it, buddy. I appreciate it. From Germany to New York to talk to Joyce about pain in her right leg. Hey, Joyce, thanks for calling. You are live.
Yes, I called 7 days ago, and you told me to get some Rustox, TOXICODENDRON.
Yeah, the homeopathic Rux toxicodendron. Now, bring me up to speed. You were having problem with your extremities, and it was worse if you were at rest, and it was better if you were moving around. Is that right?
Yes, and I fell back in June of 2011. Heel of my shoe broke, and I stopped in a seated position, just boom. And then it progressed to where I am now with all these doctors and all this stuff. But I've been on the Mighty 90 since May of this year, 2013.
Yep.
This stuff you had me get doesn't seem to be doing anything. The only thing that really helps at all, and I had to take some today because I'm having company and I have some things that have to be done, is Excedrin. So is there something in that that is also in longevity that would assist and stop the pain?
Well, Excedrin is loaded with caffeine, so that doesn't make any sense to me at all. Why caffeine would have... do you drink coffee?
No.
Yeah. It doesn't make any sense to me why taking more caffeine into your body would make this go away. It doesn't make any sense to me whatsoever. And, you know, the only time that medical nutrition fails is if we're not taking enough or we're not absorbing what we're taking.
Well, I've had my gallbladder out, so a week ago I ordered the Ultimate Enzymes because listening to the live programs day after day after day, it seems that the enzymes is possibly what I need because I don't have a gallbladder.
Right. Well, if you don't have a gallbladder, then you absolutely positively need the enzymes because that gives to your body the stuff that the surgeons removed when they yanked the gallbladder. And even though they think you can live a perfectly healthy life without the gallbladder, they're wrong.
Yeah.
So now, the last time you called, we went over the dosages, right? And we were good with the amounts that you were taking?
Well, you cut me back on the selenium. I was taking 18. You cut me back to 12.
Yeah, okay, that would be correct. And we dialed in the liquid calcium and the glucogel, right?
Right. I'm taking 18 glucogel a day.
Okay, so when did you start? The beginning of May, the middle, or the end? Do you remember?
The second week in May, I started. Okay. Another thing that I was doing, which I did an error and didn't know, was I was drinking distilled water, which I guess was taking all my nutrients out, so I guess I wasn't absorbing.
Well, there you go. There you go. So how much distilled water? I mean, how much liquid distilled water were you drinking in the course of a day?
Well, I was drinking a lot, but let me see, we just had our 50th. In August, my daughter was here, and we had a live conference call, and they said I needed to drink filtered or purified water, which I have done since August.
Okay, so August, September, so all of August, and now all of September. So my counsel to you, give it 2 more months. Give the program 2 more months. And, you know, Excedrin, if Excedrin relieves the situation, there's no harm and no foul in doing, you know, an Excedrin once every couple of days in order to help you manage the situation, because really the only thing that's in there is concentrated caffeine. And it just boggles my mind as to why that. What exactly got better when you took that?
The pain goes away. I've told you before, the pain moves around. That's why it made no sense to me for an operation, because I thought, what are you going to operate on? And so that was kicked out. Plus, I had too many other things going on to bother. But, yeah,
okay.
The Excedrin seems to take the pain away for several hours.
It's interesting. All right, there's another homeopathic remedy you can take. This is a stab at it. It's called Pulsatilla. You spell that P like Peter, U-L like Larry, S like Sam, A, T like Thomas, I-L-L-A. P-U-L-S-A-T-I-L-L-A. Pulsatilla.
And how much?
Same. If it's the 30C strength, take 2 pellets 4 times a day for 7 days. If it's the 200C strength, take 2 pellets twice a day for 7 days. Again,
well, I got the 30 of the other. Should I have gotten the 200 because I had a choice?
Yeah, the 200 is always better, but we take less of it. But look, if the 30 didn't work, then the 200 isn't going to.
Okay.
It's always better to start with the 200, and quite frankly, it is the rare health food store that has a homeopathic in the 200 strength. So you've got a good health food store there, and you need to tell the owner of the health food store that Dr. Glidden said you've got a good health food store. Okay. But, you know, I think you just need more time, because the thing about distilled water is, because there's nothing in it except, you know, H2O, that's all that there is. They've boiled everything else off. When you put distilled water into your body, there's a reverse osmotic thing that happens, and it's kind of like the water becomes a sponge. It's counterintuitive. But distilled water sucks minerals out of solution in your body, and you poop them and you pee them out.
Yeah, I learned that, and that's when I went to the filtered water. Another thing is when I take, how am I supposed to take all this stuff? I take, in the morning, I take the 1 ounce of the OsteoFX, and then around noontime I take another one. I take 2 before bed, which is what you told me when I talked to you last time. But how about all this other stuff, the selenium and the magnesium and all the other stuff that I'm taking? Do I take that all at once?
Well, if you can, the capsules, I like to spread out over the course of 2 or 3 doses a day.
Okay.
So if you need 12 selenium, you can do...
Yeah, that's how I do it. I take 3, 3, and 3, but I can take them all at once.
I wouldn't take all 12 at once. No, I would at least have 2 rounds of nutritional supplements. 1 round in the morning, 1 round in the afternoon. 3 is better,
right?
But 3 is harder for people to do, right? Between breakfast and lunch, between lunch and dinner, between dinner and bed, you want to spread them out. Don't take them all at once because you're not going to absorb them efficiently, and that's what we want. And really, once you've spread the nutrients out, as long as you're not getting an upset stomach, you're good to go. Give me a call back in 7 days, Joyce. I'll look forward to it. Ladies and gentlemen, stick around. Going to Mindy in Utah when we come back. Hey, everybody. Welcome back. Dr. Peter Glidden here with you on the 30th day of September. Going to close out the first hour in Utah, talking to Mindy. I want to know what the heck happened to Mork. Hey, Mindy, thanks for calling. You are live.
Hi, I'm calling about my 28-year-old son. He has had severe chest pain since he was about in 11th grade. And along with the chest pain, he has troubles inhaling, exhaling, getting yawns out, and then also, has excessive burping with it. And that he feels that's the only way that he gets air in and out sometimes.
Yeah, I know exactly what he's talking about. Yep. Well, okay, so he's 28 years old now. Now, how many trips to the doctors has he had? How many times has he gone to the MD?
Oh, ridiculous amounts of time.
Ridiculous. And they've got nothing, right?
Nothing. I mean, he's been to the ER thinking that he's having a heart attack.
Yeah.
He's gone in for scopes. They can't find anything, of course.
Yeah. And have they told him?
Put him on, antacids, of course, which he doesn't need. They don't help. Yeah.
Have they told him it's in his head yet? I mean, that's going to be the last straw. They'll tell him it's not.
Yeah, we've been told he needs to go to a psychologist. He's been told everything.
Yeah, don't you love that? So the MDs can't diagnose a simple problem like this. They give him the runaround. They give him this treatment, that treatment, this diagnostic, that diagnostic. Nothing works. And then because they fail, they blame the patient. Oh, it's in your head. It can't be the doctor's stupidity. It has to be the patient's. The patient's making it all up. The patient's a nutcase. That's really the problem because the doctor is the all-seeing eye of God, and it's nonsense. Now,
put him in a depression.
Yeah, well, I would agree. So what you want to do is write a letter to your state senator and say, for 14 years, for 15 years, my son's been under the care of the MDs, and they've got nothing for him. And now you're going to advocate that I buy medical insurance, giving me more access to this type of incompetence. I would like an investigation into what these people are doing because they're using tax money for, and the hospitals get some type of tax break. I know that they do. You need to make a noise about this. You need to make your disquiet. You need to make the trouble that you've had with this organization vocal, because that's the only way that it's going to change. So most of the time, a situation like this. Now, does your son have anything else like, restless legs or high blood pressure or trouble falling asleep or bad teeth or, arthritis? Or is there anything else that's bothering him?
He's had the restless legs since he was a little kid.
Yeah. Okay,
he's had trouble falling asleep forever. Yeah. Okay. He urinates nonstop.
Okay, great. So I'm gonna stop you right there. Now I knew this over the phone, and your medical doctor didn't know to ask simple questions like this, even after thousands of dollars of diagnostic work, which either means I'm the smartest man in the universe or they're idiots. Maybe it's a little combination of the two. So, most of the time, consistent symptoms like this have nothing at all to do with the breathing, have nothing at all to do with the respiratory tract, it has everything to do with the stomach and the production of acid or the lack thereof. So, the recommendation, how much does your son weigh?
I think he's right around about a 165.
All right, tell him it's not his problem, it's the doctor's problem. Tell him he doesn't have a bad gene, he has a bad doctor, and that I want him to do my program for 4 weeks in a row, and then I want him to call me back live on the air and tell me whether it worked or not. And I don't want to, if it didn't work, I need to know it. If it works, I need to know it. We're not going to, cook the books here in any way, shape, or form. 4 weeks, and then I want him to call me and tell me what's happened. So here's the recommendation.
Okay.
1 healthy digestion pack. 1 healthy digestion pack. 1 healthy digestion pack. 1 bottle of enzymes, ultimate enzymes. 1 bottle of Cal Toddy, Caltoddy. 1 healthy digestion pack. 1 ultimate enzymes, 1 Cal Toddy, and 3 ultimate selenium. Plus, eliminate the 10 bad foods. That's very important. Eliminate the 10 bad foods. Just go to my website. You can download that list for free if you sign up for my free newsletter, fireyourmdnow.com. Have him do those supplements every day for 4 weeks, and then call me back live on the air. And we're going to bust this one out, and then we're going to take it to the legislature in Utah and see if we can't get something done. See ya on the second hour, ladies and gentlemen. I'm Dr. Peter Glidden. Stick around.